We feel it is our mission to provide the most outstanding clinical care and compassionate care for our patients and their families when they are at literally the most vulnerable times in their lives. That is why this new emergency center is such a tribute to that mission.
Emergency departments across the country accounted for about 136 million visits. And if you think about that in terms of the overall U.S. population, that's about 1 in every 3 people. We are the busiest emergency department in the state of Michigan.
The emergency center here at Beaumont Royal Oak serves over 130,000 patients annually.
We're masters of resuscitation and diagnosis, but we have an entire army of other individuals who really help us, from our techs, our clerks, our nurses, to our consultants.
What makes the Royal Oak Emergency Center unique and special is that it's a level 1 trauma center, the only level 1 trauma center in Macomb and Oakland County.
We see such a diverse amount of patients, even in ages and different diseases and illnesses.
It truly is the gateway for the hospital.
We are a very large emergency department, but that'll get even bigger with the new renovation.
The new emergency department includes a new addition as well as a complete renovation of the old emergency department. Once it's complete, there'll be about 125,000 square feet, and there'll be about 117 private beds and 16 semi-private beds.
And they'll have glass doors. This will help us keep it quiet and more private for our patients. And we'll have some geriatric or senior-friendly areas as well.
In addition, we're going to have a 16-bed pediatric emergency department staffed by pediatric emergency department specialists.
A helicopter pad on the roof of the new emergency center. We'll be able to quickly access the elevators and get patients down to our trauma bays or to the cath lab in a much more efficient manner than we've been currently able to do.
We'll also have an improved lobby space and waiting area for families,
allowing for families to have a place to go out to, take a rest, get some hot food if they'd like, or even go for a walk.
The most important partners in the care that we provide are our patients and families, and we were very proactive and dedicated to partnering with them. They help to inform our design, our construction, so that we can ensure that their ideas, their thoughts, their experiences could be optimized in this project.
We were going out that night, and Missy takes one look at me and goes, "What's the matter with you?" And I could not speak at that point.
He was just standing there, staring at me, and there was no response, and I called 911.
And we got pretty immediate attention from the emergency crew.
And they quickly determined that, yes, he was in fact having a stroke. And so they gathered him up, started taking some tests. There was a nurse there who was just wonderful, Barbara. You know, I knew she was staying late, and it was hard.
And it was just hugely reassuring that they were staying with me, you know, on their own time, so to speak, to make sure that this was going okay. And I wasn't just another number. They really and truly cared.
With this multi-phase project, the first phase being that we are really opening our doors on the newest component of our emergency center. However, we are not stopping, we are not settling. We are going back into our existing emergency center and renovating to create the same standards, the same amenities, so that we have a continuous experience for our patients and families. We are incredibly proud, enthusiastic. We can't wait to open our doors officially and to welcome those that we serve into an environment that is really going to optimize what we can deliver for them.